Hello everyone, welcome back to my channel. This video is continuation of salivary glands. Previously we talked about parotid gland. In this video we will cover submandibular and sublingual glands. So yeah, let's get started. Submandibular glands are walnut shaped and they are also bilateral salivary gland located in the face. There is always a confusion whether submandibular is mixed or sublingual is the mixed. So submandibular has M, so M for mixed. So it has both serous and mucous salivary secretion, which helps in lubrication of food, that ultimately helps in swallowing and digestion. Submandibular gland is divided into two portions, superficial portion and a deep portion. Talking about superficial portion, we can see in the diagram it lies just between the mylohyoid muscle and the submandibular fossa of mandible. That is a part of our submandibular triangle. Deep portion lies just in the floor of the mouth between the base of our tongue and the sublingual gland. Also, we can say that deep portion is superficial to mylohyoid and hyoglossus muscle. The nerve supply. Now talking about the parasympathetic innervation. The preganglionic fiber arises from the superior salivatory nucleus, travels via the cauda tympani branch of facial nerve, which joins with the lingual branch of mandibular nerve. Then this will synapse at the submandibular ganglion, after which the postganglionic fibers goes to the submandibular gland. We can see in the diagram. That much we need to remember. Talking about the sympathetic innervation, they originate from superior cervical ganglion. They will form a plexus on the external carotid artery, internal carotid artery, submental artery, and then it enters the gland. We need to remember that increase in the sympathetic innervation will decrease the salivary secretion via vasoconstriction. The submandibular gland duct, which is also called as Worthin's duct. Worthin's duct continue forward from the deep portion of the gland and it empties into the oral cavity at the sublingual caruncle, or we can say sublingual papilla, next to the sublingual frenulum, which is behind the lower central incisors. Blood supply is through the facial artery and the lymphatic drainage is into the submandibular lymph nodes. That's all about submandibular gland. Sublingual gland. Now this gland is an almond shape. It is the smallest gland. This gland also is kind of mixed, but it is predominantly mucus in nature. Okay, and these secretions are important in lubricating food, keeping the oral mucosa moist, and for initial digestion. We can see in the diagram that sublingual gland is also located in the floor of the mouth and it is medial to the sublingual fossa of mandible. This gland is above the mylohyoid muscle. We can see the brown color thing is the mylohyoid muscle and on the top of it is the sublingual gland. Important thing to remember in this slide is the sublingual gland ducts. So now the Revian ducts are multiple small openings into the oral cavity and they open through openings into the sublingual fold. Sometimes there are also this anterior duct which open medially and this is known as Bartholin duct. So Bartholin duct is a single duct of sublingual gland which joins the submandibular gland duct. And this also open at the sublingual papilla. Innervation of sublingual gland. So beautiful thing is that it is similar to that of submandibular gland. So the parasympathetic innervation will be from superior salivatory nucleus. Ganglionic fibers goes through the cauda tympani branch of facial nerve, which joins the lingual branch of mandibular nerve, and then it goes to the submandibular ganglion, Postganglionic fibers from this ganglion goes to the sublingual gland. So the increased parasympathetic innervation will promote salivary secretion, while increase in the sympathetic will decrease the salivary secretion. Okay. So talking about the vasculature, the blood supply is via the sublingual, which is a branch of lingual artery, and the submental, which is a branch of facial artery, both of which are branches of external carotid artery. Venous drainage is through same sublingual and submental vein, which ultimately drains into the lingual and facial vein, and that will drain into the internal jugular vein. That's it for all the glands, the major salivary glands. Thank you so much for watching the video. If you do like it, then just to share, subscribe to my channel, and maybe next video I will start building questions also along with the topics. So see you in my next video. Till then, bye bye. Happy studying.